Good afternoon. My name is Dr. Cheasty Anderson. I'm with the Children's Defense. Cheasty, yes, rhymes with tasty and other, you know. Anyway, don't worry about it.
Yeah,
so,
it's a good start.
It's a good start, yeah. I needed a good start after that last testimony. I'm not sure I'm going to improve upon that. I'm here to testify in support of Representative Coleman's HB 565. As you know, Texas has both the highest rate and number of uninsured adults and uninsured children in the country. Our uninsured rate for children is double that of the national average. And when you break down our uninsured rate for adults, it's even scarier than what it looks like when you aggregate all the numbers. For example, the rural uninsured rate is 36%. Our current Medicaid program, as you know, with very few exceptions, does not cover adults. The people who fall into our uninsured population are largely low-wage workers, students, and caretakers. They are daycare workers, truck drivers, construction workers, house cleaners, students, and caretakers. They are stay-at-home moms and other people like that. They are parents struggling to raise healthy children without access to health care themselves. I asked this committee to take into consideration recent polling data, which found that 87% of Texans believe that increasing access to health insurance is either a top priority or important, and that 64% of Texans support a Medicaid expansion. These poll results are similar to findings in other Texas polls and correlate with data that consistently show health care being one of the top 3 voting issues for Texans. Additionally, I'd like to note that in addition to these poll numbers, in 2015, when we were making a big push for this, we had 26 chambers of commerce from around the state of Texas that all had policy platforms supporting a Medicaid expansion, a letter from bipartisan county judges asking for a Medicaid expansion, as well as support from THA, TMA, Torch, and other associations like that. Texans are very concerned about our dire healthcare situation, and the reason that we are concerned is because it impacts so many of us personally. In fact, just yesterday, a rally on the steps of this Capitol building drew advocates from around the state to advocate for the right to vote on this issue through a ballot initiative if the legislature fails to act. These Texans came because they don't want their rural hospitals to shut down for a lack of funding. They want working-class parents to have health insurance. They want college students to have health insurance. They want that health insurance to be comprehensive and affordable and to cover substance abuse, mental health, maternal health, and pre-existing conditions. They want everybody to be able to afford the medication that they need to get treatment for cancer before it spreads. They want their families to be at much lower risk of medical bankruptcy. These items are things that your constituents worry about day after day, year after year. We at the Children's Defense Fund are asking this committee to pass this bill into the House so that we can have what is long overdue, a thorough and wide-ranging debate on this question. Texans are nearing a crisis point. For this body to do what it is intended to do, to tackle big problems, to ask hard questions, and to find the right solution, we must consider all of the options, and we have thus far failed to do this with regard to our uninsured problem. This bill offers one possible solution available to us. Let's talk about it. I also have these cards that are in support of the bill from advocates who came to the rally yesterday. I'm not sure if I'm supposed to turn these in. Okay, there you go. Anyway, thank you very much for your time.
Thank you, Doctor. Is there any questions? Thank you so much for your testimony.